Hello, and thank you everyone for joining us a little bit early. Jenny, do you want to do a quick sound check?
Sure, how's this, Sue?
All right, you're sounding good. Okay, Jenny, I don't know if you want to just kind of go over some of the preliminary stuff with people as they're joining while I keep working on getting Melissa in.
Sure, I can do
Okay,
that.
thanks.
So, welcome everyone. As the slide says, today's training will be interactive, and on the screen here you see how to access the responses. Um, the slides are turning automatically, but essentially you look to the bottom of your screen to see bubbles such as the chat bubble, the print bubble, where you can see the panelist names. And then below the panelist names, there is a megaphone icon. And the megaphone icon allows you to answer yes/no questions. And on this slide, you can get some audio tips, although you're not able to hear me if you need audio help. So with that, I am going to mute myself. And again, welcome. Feel free to chat to all panelists if you need any assistance. Welcome to everyone who's just now joined. This is Jenny Paulson with the SHIP TA Center. We'll get started in a few minutes, but meanwhile, there are some WebEx tips scrolling on your screen. And also want to draw your attention to the chat where you can find links for English captioning and Spanish captioning.
Hey, Paul, did you see the message that I sent to you?
I got a message from Rebecca.
Yeah, I sent one too with an email address.
Okay, probably further up on the panel. But yeah, I will get them joined. They can also, if they join as an attendee, yeah, we can just promote them up. I'll
I
steal
can't
them
get her
before.
registered since it has already started. It won't let
Okay,
me.
they can join with my email address.
Okay, can you chat that to me?
Yeah, let me send you a private message.
All right, thank you.
Paul, if you chat it to me, I'll text it to her.
Okay, thank you, Rebecca. All right, to everybody who's joining us a little bit early, thank you. We appreciate it. We've got a lot of folks who are interested in what's going on in today's call. I do have a file transfer box up on the screen right now that will be disappearing here shortly when we get started. If you cannot see that file transfer box or just don't get it downloaded before I close it out, no worries. We do have today's PowerPoint already in the SHIP TA Center resource library. You can go ahead and log in there and be able to use PowerPoint from there. By the way, if you ever join any of our events and you want to get the resource ahead of time, you can do so just by logging into the SHIP TA Center Resource Library about an hour before the call. We usually have them there. That is a popular question we hear from folks is that they want them ahead of time, and we do have them there. You just need to go looking for them. And I go ahead and add the link to today's resource into the chat. So if you do want to go directly there, you will need to log into the library in order to have that link take you directly to today's resource. But that will give you today's resource, and then within 24 hours, I'll have recording in the resource library as well. And good news for anybody who's joining us a little bit behind start time is we're having some issues with getting our presenter on, not through any fault of her, but there's just something going on with getting her into WebEx. So we may be just a moment getting behind in getting her on. Again, we will be getting started here very shortly. Be able to promote her up panelist when she gets in?
Once they join, if they use the panelist link, they will be able to join as a panelist using my email.
Okay.
There shouldn't be a restriction on how many panelists use the same email since I have both WebEx producer and WebEx support joined under the same email.
Okay, got it. So I think what I will do is if you can kind of keep an eye just in case she does somehow make it in as a attendee, your name, I'm going to go ahead and maybe go through these first few slides. Does that sound like a good idea, Rebecca? Because we've got the polling and some questions, or would you rather wait for Melissa to get on?
Yeah, it's a great suggestion, Sue. I think I'd rather wait for Melissa because I think she is interested in the answers to the polling questions.
Okay.
So thank you.
Not a problem. Yep.
Otherwise, I would say I could jump in and help too, but I don't want to jump ahead of that on her.
Have her all rushed. Well, and for anybody who's on, we are just having a little issue with getting Melissa on to do the presentation. She did start trying plenty early. We've been getting emails from her, just some sort of a technical issue, but we are working on getting her on. So don't hold it against. I promise that she's done everything that she could to get on with it. In the interim, you do have a file transfer on that has today's PowerPoints on it. I will also rechat the link that you can get today's PowerPoint from the resource. So if you cannot see that file transfer box, there's plenty of options of you can get today's resource. Also, we do have closed captioning on the call today. You can see that in your chat that you can click on the link, whether it's English or Spanish that you want, and it will open in a separate window. And Sarah, well, go ahead and have you get on and let our Spanish-speaking folks know about that.
Sure. Hola y bienvenidos a todos los participantes de hoy que primariamente hablan español. Tenemos subtítulos en español para ustedes. Haga clic en el enlace en el mensaje de chat de Zoom y los subtítulos abrirán en una ventana nueva.
All right, fantastic. Thank you. So, Paul, she is still getting error messages using yours and Jenny's email addresses.
They may have to close out, refresh, or try a different web browser.
Okay.
I reposted the panelist link in the chat too.
Okay. I'm going to forward you her email that she sent just so that maybe you can see something that makes sense to you from her screenshot. Again, thank you to everybody who's joining us early on this call. Sorry, who's joining us at this time. We are having a little bit of trouble getting Melissa do the presentation. She has been working diligently for about 20 minutes now, and unfortunately, we're having some sort of a technology issue, but we will be getting started as soon as we can. Hopefully, Dan, technology sometimes just doesn't do what we want it to do. We will be doing a couple of quick polls when she gets on, but otherwise we will dive right into the information. I have the WebEx tips screen on right now. I'm not going to go over all of those details when she gets on, but I want to let you that we will record what she's on so that if you need to go back and listen to something later, that recording will be in the resource library by this time tomorrow. We will start it as soon as Melissa gets on. I apologize to anyone who is having issues that maybe has something else to do and won't be able to stay on for the whole call. But we do have 90 minutes, and hopefully it's just another couple of minutes before we get Melissa on with just another couple of minutes. And yes, the screen you are seeing is a WebEx Tools screen. I just haven't moved forward. I guess I will so that no, I'm going to move to this one. Just so you know, you're in the right place. Yes, you are in the right place. We're having a little technology presenter getting on, but if you will hold tight with us just a couple of more minutes. Oh, I see her name now. Or, no, I don't. I see the wrong name, but maybe it's Melissa. Is that you? No.
No, it's Marissa.
It is Marissa.
Hey, I offered Melissa MySpace, so I'm going to see if she can log in as me.
Okay, thank you.
Okay.
All right, progress there. So Marissa was able to get on, so hopefully Melissa is able to get on as her. It's like tongue twister time. So you are on the right call. I apologize that we're a little bit behind on getting started. Technology sometimes doesn't quite know what it is that we need them to do, right? By the way, we do have a WebEx producer on today. Paul can help you out if you're having any technology issues. Just go ahead and chat directly to WebEx producer. Otherwise, once we get started, if you have any content-related questions, please chat to all panelists, and we will be able to answer your question, hopefully, through that chat. We are not taking raised hands today because we have far too many folks on the call, so that's just going to be possible. If you have a question, you'll need to chat that. All right, Marissa, Melissa, is that you? You just need to unmute your line.
I need to unmute my. Thank you.
Yay! All right, fantastic. Thank you. All right, technology at its best. So we have Marissa, Melissa right now. I'm going to go ahead and open up the poll right now. Melissa really wanted to have you answer polling questions. I am going to open it. Please, hopefully you can see on there. Oh, wait a minute. I am going to record. All right, thank you for joining us today. We're going to start things off with a polling question. And if you cannot see the polling or can't figure out how to do the polling, no worries, not a big deal. Just sit back, relax, and watch what's going on the screen. But if you can see the polling, if you have used the Medicare Plan Find for less than a year, 1 to 5 years, 5 to 10 years, or 10 years or more, make sure you hit submit after you have selected your answer so we can see how long you've been on here. This is going to help Melissa to have an idea of who actually can Medicare Plan Finder. And we'll have a couple of questions here that you'll be chatting in a few minutes. So if you can't see this, do open up your chat bubble on the bottom right hand corner of the screen so that we can have you chat some answers here in a little bit. All right, still lots of answers coming in. All right, I am going to close this out. You've got about 20 seconds to still get your answer in. Again, hit submit so that it's registered with everybody else. I see some of you are chatting your answer. That's fantastic. Thank you so much. All right. Melissa, can you see those answers or did you want me to read them off?
See, oh, I can see them.
Okay.
So yeah, looks like we've got a pretty good mixture. A good number of folks in each of those categories. Thanks, Sue.
You're welcome. By the way, if you want to close that out so you can see everything else, just click the X in the corner next to polling and that will get out of your way. All right. And Melissa, did you want me to read these or were you going to read these?
Sure, I can. Thanks, Sue. So one thing I wanted to know is, what do you hope to learn from the Medicare Plan Finder training today? So Plan Finder demo, we're definitely going to do that. Definitely use the Medicare Plan Finder, get some shortcuts, some tips, any updates. Oh yeah, lots of updates. New enhancements, pitfall, void, lots of stuff. Okay, new features, changes, anything new, shortcuts, demos of insulin, definitely going to do that. Calculating cost savings. We're going to focus on that today, but we do have some videos in the SHIP TA that they've created that'll be really helpful. So great, lots of new things. Okay, Sue, if we could, I don't know, typing or you.
I got it, but I'll pass you the ball here now.
Super, thank you. Okay, and then what I'd like to know next is, what's your favorite thing about Medicare Open Enrollment? So if this is your first open enrollment, you might not know yet. But if you've been through an open enrollment period before, what's your favorite? Oh, right, helping folks, helping them save money, helping folks. Yeah, it's such a great time helping people save money. Yeah, absolutely. That was one of my favorite things about direct help that I was giving with folks, helping people save money. Yeah, lots of saving money. Helping save money. Yeah, it's such a good feeling. It's one of the most rewarding things. There are great things about this work. Educating folks, helping them with Medicare, walking people back from the cliff, sometimes ourselves, right? Medicare open enrollment can be really stressful. Winning insurance companies, okay. So I think generally helping people with this complex system. So great, thank you all for sharing those things. So I wanted to just share just a little bit about myself before we get started. So my name is Melissa Simpson. Thank you so much, everyone, for your help and patience while I was getting joined. And thank you to my colleague Marissa for loaning me her credentials to log in. So I am the Assistant Director of the OHIC office. So we are the office at ACO that administers the grant programs that you know as the SMP, the Senior Medicare, the SHIP, the State Health Insurance Assistance Program, the MIPA grant program, Medicare Improvements for Patients and Providers, and then we provide some supports to ombudsmen and SHIPs that work in a CMS demonstration called the Financial Alignment Initiative. So background, I've been with ACO about the last 6 years. Before that, I worked at NCOA for a couple of years, and then prior to that, I was a SHIP director in my home state of Arkansas for 7 years. So I had the opportunity there to help beneficiaries directly. It's been several years since I've done that full time during open enrollment, but I am very popular with my family around Thanksgiving to help with Medicare Plan Finder. So I want to also thank you, all of you, for everything that you do, for all the things that we know about and lots of unknown ways that you're helping Medicare beneficiaries and their loved ones. And thank you for all the preparation you're doing to start this marathon race that we call open enrollment. So today's presentation, so we're going to focus on Medicare Plan Finder, but I do have some things that I want to walk through on slides first. So we'll talk about the Medicare open enrollment period in general, Medicare Plan Finder, and after Medicare comparison sessions, and then some guidance from ACL about Medicare.gov accounts, the complaint inquiries that come up a lot this time here, and then we'll move into the Medicare Plan Finder demonstration. So how's this whole timing going to work? So these slides, it'll take 20-25 minutes to get through these. We'll take a break, but it's going to be brief, probably just about 5 minutes to answer some sort of like big theme questions that folks might have. Then I'll move into doing the presentation on Medicare Plan Finder. I'm going to do, plan is to do 3 different demonstrations. I'll do one on an anonymous search. So what if you're not logged into Plan Finder? Then we'll do a search using insulin, so you can see that comparison process. You know, what we're going to have to do for this open enrollment period and throughout all of next year. And then we'll take a break. We'll have, again, pretty short, maybe about 5 minutes. But please do chat your questions in as they're coming, as we start going through the presentation. And Rebecca is going to be monitoring those and help when we get to those break sessions to kind of get to those big themes. And then the last demonstration will be about how to use the Medicare Advantage Plan Finder. We'll talk through some resources, and then if there's time, we'll do a final question break. So that's the plan for today. I'm excited to be with you and to get started. So Medicare Plan Finder, Medicare enrollment periods. Let's start there with what's on the slide. So in the next 6 months, there are a handful of enrollment periods that occur. So just wanted to take a moment to talk through these. October 15th through December 7th is the annual Medicare enrollment. You'll also see this called the annual election period. It's one of the things when you start learning about Medicare, there are multiple names for one thing. So I just wanted to remind you of that. During this time frame, you can enroll in or switch Medicare Part D drug plans, so PDPs or prescription drug plans, or Medicare Advantage. We'll see those in these slides a lot of times as PDP and MA. And just a reminder here, Medicare Advantage plans, some of them have prescription drug coverage and some do not. So that's the thing you need to keep an eye out for when you're comparing those types of plans on Plan Finder. Next spring, early spring, I suppose, from January through March is the annual Medicare Advantage open enrollment. And that is a time when you can enroll or switch just one time into a Medicare Advantage plan. Now, to do this, you have to already be in Medicare Advantage or an original Medicare. This is also the time frame called the Medicare General Enrollment Period, which is when folks who missed their time to join just regular old original Medicare A and B, they can sign up. The third bullet on the slide here says other. So there's, folks might be having their initial enrollment period during this time frame, so they're just becoming eligible for Medicare. And then there are multiple special enrollment periods, and the timing on those varies. Webinar on Tuesday related to policy, and there's a lot more information in those slides and in that recording related to special enrollment periods. So if that's something you want to learn more about, be sure to check out that presentation. So what about Medicare Plan Finder? So you've probably seen it by now. Medicare Plan Finder is an online tool. It's the official government Medicare website. It's available for folks that are logged into their Medicare account and also through an anonymous search. So we're going to look at both of those paths to compare today. On the third bullet, it says it allows users to compare Medicare health and drug plan options. So we're going to we're only going to look today at Medicare Advantage plans and Medicare plans. But there is a third type of plan that folks can compare at Medicare.gov called Medicare Supplement Insurance or Medigap policies. And so just wanted to remind you of that. We're not going to focus on those today, but those are available. The second to last bullet says that the Plan Finder provides detailed information on cost, coverage, and benefits for plans in your area based on your prescription. So we're definitely going to take a look at that today. There's a reminder about the link at the bottom of the slide. And then a few of these slides, I borrowed the content from the CMS National Program. So you see that CMS NTP. They did a webinar last week on the 28th called Boot Camp. And well, we did 2 webinars, but the first one really focused on Medicare plan. So if you want to go get a more detailed look at Plan Finder through slides, that's a really great resource. A really, really great job there. Okay, so what do you need to do to prepare for a Medicare Plan Finder comparison session? So if you have the luxury of setting an appointment in time, that's great. A lot of times folks are just walking in. You might be at an event somewhere and you've just got folks lining up throughout the day. But if you have the opportunity, bullet 2, set the expectation with the beneficiary that they might be with you for an hour or longer, particularly if they are an insulin user or if they need help setting up a Medicare.gov account, or it's not listed on the screen here, but if they want help comparing Medicare Advantage plans. Those 3 things just take a little bit more time. And there are some beneficiaries out there that are going to have a difficult time sitting for 60 minutes or longer. So any of that preparation work that you can do before they get, if they're coming to see you in person, can be really helpful. This next bullet says simultaneous Medicare Plan Finder login is no longer available. That's really important. I know a lot of y'all relied on this last year and through part of this year. And in here is if the beneficiary is at their computer and you are at your workspace at your computer and y'all are talking on the phone, the 2 of you are not going to be able to log in to that beneficiary's account at the same time. CMS made this change due to security protocols, and so they're not able to change it back. So what we're going to have to do is use tools like WebEx or Teams or Zoom or Skype or whatever you have at your disposal to share screens to walk through this stuff with beneficiaries this year. You're also going to need some forms. We have, we expect y'all to report on the work that you're doing. You do that in the STARS system, called the Beneficiary Contact Form, or the Beneficiary Additional Sessions Form. Some folks use those second forms, some don't. If you have a proprietary, your form might be something else, but it will be sent into our system called STARS. You'll also need something like a pre-enrollment form. There's a really great example in this toolkit that was put together from the SHIP directors and the SHIP TA Center year before last, this in 2020. So there's a link here on the slide. And then also on the right-hand side of this slide is just a snippet. So I took a picture of the SHIP TA Center's public web page, and they have a bunch of virtual counseling tools that they've gathered. So those of you haven't, those really can help you save time. My last reminder here in Plan Finder comparison sessions is to log out of Medicare.gov after each session. So if you are logged in, just be sure and log out, because if you don't, the next person that comes in, it's, their information is still going to be up on. So what do you do after enrollment? So, you're going to see lots of folks during open enrollment. Some of them are going to want to enroll while they're there with you, and that's great. Some won't, and if they don't want to, that's totally fine. There's no pressure for them to enroll, but if they choose to enroll, what you want to remind them of is that their new plan will start January 1st. They don't need to do anything. The enrolling in the new plan is going to automatically replace any Part D or Medicare Advantage plan that they had previously. Another reminder here to report for SHIPs on the beneficiary contact form, and be sure to check both the plan compare and enrollment topic. And then I added this last note here from ACL. Had a handful of cases early last year where beneficiaries did not pay their premium. There were a variety of circumstances that led to this happening, but the reason I'm saying this is that ultimately it is the Medicare beneficiary's responsibility to pay their premium. And so it would be really great if you would remind them to follow up with their plan and ensure that their plan received their payment. If they don't receive the payment, the plan can cancel their policy. And if that happens, then it's possible that they wouldn't have coverage for the whole. They'd have to wait a whole year until next open enrollment period to get a Part D coverage. And we really, really want to avoid that. So be sure and remind folks of that this year, please. So what if you are reporting Part D enrollment outcomes? So we call this PDEO reporting. This applies only if your SHIP is participating in PDEO reporting. This year, because we've got a different situation with insulin in 23 related to insulin, we are asking that folks report the plan details page that includes insulin. So we want you to keep insulin on the plan detail page when you're reporting Part D enrollment outcomes. Because of this, that bullet underneath, we don't want you to add any calculations for insulin. This is really the cleanest way to do this, the simplest way for this year. The third main bullet says, be sure and enter the cost information in the special use fields 1 and 2. And finally, you either want to upload into STARS or save your paper and electronic verification documents for auditing later. And so I've got 2 boxes here on the screen. What you need, what are the verification documents required for each type of plan enrollment. So the box on the left talks about what you need if you're switching plans, which means someone's already in a plan and they're just moving to a different plan. They're switching to another one. You need to attach the plan detail page views for the original plan plus the new plan. You also need to the enrollment verification for the new plan. On the right, we have a box that shows what you need to attach for Medicare, new to Medicare beneficiary or SAVE. You need the plan detail page view for the new plan only. And if you need a refresher about how to calculate those costs for new to Medicare folks or new to a Medicare plan, be sure and review that in Chapter 7, the STARS Manual, Chapter 7. Additionally, for new to Medicare, you want to attach or save the enrollment verification for the new plan. Now, at the bottom of the slide, I have it's a small reminder, but it's a big reminder. We made a change starting October 1st. If you report Part D enrollment outcomes, you must collect the plan details page view. We were just missing too many details in some of the screenshots that folks are putting in, and so this is the easiest way for us to do this. There is, on this next slide, just a reminder that there is an enrollment notification that's going to be sent to Medicare.gov account holders. So if you are helping someone enroll and you forget to get that enrollment verification or enrollment confirmation form, you can go and get it in the message center. So just a reminder that you can grab that there. Okay, now we're moving into the portion of ACL's guidance. So we've got 3 or 4 slides, maybe 5 slides here about different things, ways to report things and how things are during open enrollment. So Medicare.gov accounts, well, this applies all year long. ACL on this is housed both in the S&P and the SHIP libraries, and basically there's a lot more verbiage in the guidance, but here's the highlights. What we want you to do is when you're helping someone create a Medicare.gov account, you are to obtain their consent and only access their account when necessary. So need to with your SHIP's written or verbal consent policy requirements, and you should not store Medicare account credit in STARS or SIRS, which are the databases that we use for SHIP and S&P. There's a tip sheet about how to create a Medicare.gov account, which is available at this link if you want to review it. There are also some troubleshooting options on Medicare.gov if the beneficiary doesn't remember their username or password. There's some links. If you forget both username and password, there's a link. And then if all else fails, you can contact 1-800-MEDICARE or use the CMS Unique ID hotline to reset those username and passwords. So what about Medicare Plan Finder inquiries? So you're using Medicare Plan Finder and you see something that doesn't look right, or your Plan Finder's not loading properly on your computers. All kinds of things can happen. So we receive a lot of inquiries about Medicare Plan Finder this time of year. We categorize them in two basic groups. The first is general feedback. We log these on a spreadsheet. We share them with CMS on a weekly basis. We talk through them. The second type is a functionality issue. These also get logged on the spreadsheet. And if there are some trending issues, or if there's a work stoppage, like Medicare Plan Finder is not loading, or something along those lines, we'll escalate those to CMS immediately. If you have a beneficiary that you're working with and you've got some issue with Medicare Plan Finder, the second bullet says that the first step really is to call 1-800-MEDICARE or the Unique ID line to resolve that beneficiary's immediate need and to report the Medicare Plan Finder concern. So CMS monitors Medicare Plan Finder happening through the 1-800-MEDICARE line, as well as through things that we're reporting. So what if you have some issue with Medicare Plan Finder, but it's not unique to a beneficiary? So what you should do is email your local, regional, or state SHIP leader. That state SHIP leader is then going to send that to the SHIP mailbox. I've got listed here on the slide all of the information that you need to enter. It's also in some written guidance that we've shared, and I'll share it again next week just to get it out there again. And just a quick reminder here, the last bullet, if you're sending Medicare numbers via email, these have to be encrypted in order to protect that person's identity and to comply with HIPAA regulations. The final slide we have here about Medicare Plan Finder, complaints and inquiries is about drug pricing. So we tend to get a lot of these during open enrollment period. So when there's an issue and it relates to drug pricing, what we'd like you to do is email your local, regional, or state SHIP leaders. They monitor those trends, email it to us. For CMS to investigate, we need the information on the screen. Dosage, quantity, frequency, packaging, or if you have it, the national drug code number. We need the pharmacy name, the address of the pharmacy, and if it's available, the national provider identifier. You need the plan name you're looking at, the type of plan it is, the plan ID number. You need the zip code that you used to conduct the search, and then we also need to know whether that search was anonymous or if you were logged in when you were using this Medicare.gov account. And all of that information is necessary for the CMS Medicare Plan Finder team to be able to go in and investigate and try to recreate what y'all are experiencing. So if you don't send this stuff in, when you report it, what is email can say, hey, we need these pieces of information. So just keep that in mind. That's what we're looking for. Okay, plans and unique IDs. So we had a couple of plans that updated their practices earlier this year, and it even led to some inquiries. So just a reminder that plans are encouraged to participate in the 1-800-MEDICARE system, but they're not required to do it. We can't force them to do it. CMS requires that the plans obtain beneficiary consent when using these Medicare Unique ID numbers. So the rest of this slide is really describing what's required of the plans by CMS. So the plans call center has to confirm these things. They have to make sure that the SHIP counselor has a written or verbal authorization from the beneficiary or their representative to talk about the beneficiary's issues and concerns. And the counselor has to be on the SHIP Unique ID database system. So if those two things happen, this last graph on the slide says the customer service representatives, the CSR, must ask questions to verify the identity of the beneficiary. So they ask you a bunch of stuff about the beneficiary. They're also going to ask you about yourself. You're going to have to identify who you are, your name, your state, your program. So all of that information could be required. I will give an example. There are plans that decide to add this. And I believe it was Wisconsin emailed recently, and they had been talking with the plan and mentioned this, and the plan was interested, in being able to accept the unique ID. So a good reminder. This is also the same information that you'll be asked if you call when you have Medicare to use your unique ID to verify that you have the beneficiary's consent to do these things. What if you have a complaint or a concern about your unique ID or about a 1-800-MEDIC customer service representative? There's a specific form that you need to email your local, regional, or state SHIP leader. It's called the Unique ID Complaint Form. And then that state SHIP director is going to submit that to our SHIP mailbox. It's really important to use this Unique ID Complaint Form because it ensures that we've collected all the information that's listed on the screen that CMS will need in order to investigate. CMS records all of the calls with the CSRs, and based on your report, have gone and done some additional training from CSRs based on what you all have shared. So it's important to use that form. What about marketing, potential marketing violations? This comes up a lot this time of year as well. So just a reminder, if there's no beneficiary involved, so if you're, the concern is, misbehavior at a health fair and you have some questions about it, you would contact the plan to report the misbehavior. And this might seem a little counterintuitive, but plans, they want to be aware of when this is happening as well, because they don't want bad actors representing them. Second, you email the CMS complaint tracking module point of contact and copy the ACL mailbox, ship at acl.hhs.gov. You want to use this global protocol form and the marketing material submission form if you're submitting materials. Finally, if there's an agent or broker involved, you want to contact the State Department of Insurance because the Department of Insurance regulates agent behavior. And so they can advise whether that agent has been misbehaving previously. Second, what if it's a beneficiary case? So a beneficiary is involved and the beneficiary got enrolled into a plan based on agent misrepresentation. What do you do? So again, contact the plan that was involved, submit a case via the complaint tracking module, CTM. If you don't have access to CTM, what you would do is call 1-800-MEDICARE and they will file a CTM complaint on your behalf. We also would like you to email ACL at the SHIP mailbox and again, contact the State Department of Insurance if there's an agent involved. This yellow box on the right here is just a reminder that the SHIP and S&P Resource Centers along with CMS hosted a webinar in mid-September called Can They Do That? And so if you need more information about how to report these cases or about potential marketing violations, that's a great resource to review. Which is just a couple more slides here. I wanted to share a little bit about Inflation Reduction Act. So I know folks have heard a bit about this and been asking some questions. So just as a reminder, the Inflation Reduction Act was passed mid-August, and it does a lot of things. The thing that we're really focused on right now is the cost sharing limitations for insulin, which are amazing protections for beneficiaries. So you probably know there are about 64 million Medicare beneficiaries, and about 3 million of them use insulin. So it's a relatively small group of folks, like less than 5% that are going to be impacted by this. But for those 5%, it's a massive change. So what it means is that they'll pay no more than $35 for a 1-month supply of each covered insulin. So for Medicare drug plans and Medicare Part D, this change starts January 1 of 2023. The $35 copayment applies through all of the coverage phases, every single one of them. The deductible, the initial phase, the coverage gap, and catastrophic. $35, that's it. Amazing. The beneficiary's true out-of-pocket costs will be that $35 copay as well. The next bullet says the plan deductible not apply to the covered insulin. So even in the deductible phase, they're only going to pay $30. So cool. Next, it says Part D senior savings plans may have lower insulin copayments, but what you're going to see when we do one of these comparisons is you really got to look at the overall coverage, because beneficiaries often take more than one medicine, and it depends on what other medicines they take, and also figuring in the premium. So, following that process that CMS laid out for us a couple of weeks ago is really the right way to go. For Medicare Part B, as in boy, so Medicare Part B covers insulin when it's used with an insulin pump that's considered durable medical equipment. That change is not going to happen until July of next year. So that means that from January through June, the Medicare Part B, as in boy, deductible will apply to insulin. If someone has a Medigap policy that covers the Part B deductible, that coinsurance would be covered by their Medigap policy. The last bullet I have on this slide is just a reminder that the Medicare Plan Finder is not going to reflect these $35 insulin copayments at all. It's not going to reflect it during open enrollment this year. It's not going to reflect it next year. It will only be updated when the Plan Finder is updated next October in 2023, and it's going to be updated for 2024 plans. So what that means is during this open enrollment period and throughout all of next year, we're going to need to do this process where we're comparing plans without insulin, adding the insulin back, and then comparing the costs again. So we need to be really mindful of that and keep that in our planning. The drug cost sharing, the reason this can't happen is the cost sharing for medications is set in the annual bid process, and that can't be updated until the next bid process. You will see fluctuations in drug prices called original cost, and that means like in the switching plans, if the person is already in a plan, we call that their original plan. So you would list the cost that shows on their original plan, and what we are asking for here is the cost that includes the drug cost plus the monthly premium. So it's the total cost for that plan that's estimated. And then you would, in special use field 2, you would report the new plan's cost. And then you also need to attach the enrollment verification or the enrollment confirmation, request confirmation. The SHIP TA Center has some really great videos about what needs to be reported where. They're short, they're very instructive, so I would really encourage you, if that still sounds confusing, to go and review those videos for some more help.
Great. Thank you, Melissa. I think one more thing, I don't know how much more time you want to take for questions, but there are a lot of questions about which insulin will be covered by this, or drugs are considered insulin. A lot of requests for a list of insulin products. I don't believe we've seen anything from CMS on that yet, have we?
No, I haven't seen a list of insulins. I do, one of the easiest ways to do that as a counselor would be just to ask the beneficiary, do you use insulin? They'll know. But I think, Rebecca, you mentioned a site the other day in the webinar where folks could get some ideas for insulins. Could you share that again? I don't remember what it was.
Happy to. Yeah, when I was counseling prior to coming to ACL, I would often use drugs.com to look up what a medication is. And I found that helpful to really identify which category a medication might fall in. And I think another point that might help with clarification is the law is specific to insulin, not to the other drugs diabetics could be taking to help them control their insulin. There's a lot of other types of medications that they're taking, maybe orally, that don't fall into the insulin category and therefore would not have that $35 copay because of the way the law is written. So it's really narrowly focused on the insulin products themselves.
Oh, one of our directors just shared that there is a list of insulins participating in the senior savings model, which might help get a list of the insulins. I will chat that out to everyone here in a minute so everybody can see it. And another thing Melissa and I will do is we'll talk to CMS and see if they have a list that we can use. If we find something that is appears to be reliable, we'll share it with all the directors so they can share it with you.
That sounds great. I think we probably ought to move on at this point. I want to be sure and get time at least to make it through the anonymous search and the insulin search. So let's go on and move to that. Thank you, Rebecca. So I've gone to, hopefully can someone just verify that you can see my internet?
Yep.
Super. Okay. So I'm going to type in medicare.gov, hit enter. Ooh, now something that happens sometimes during open enrollment is CMS will make updates to Plan Finder, and then you log in and something looks a little squirrely on your screen. It's not working like it was the day before. So one thing I would recommend you do if that happens, or if something just isn't loading properly on Plan Finder, so I'm going to show you how to do this in Chrome. It'd be a little different in each browser, so Google how to do it in your browser if you're not using Chrome. So I'm going up to these three little dots up here in the corner. I'm going to pick More Tools, and then I'm going to click Clear Browsing Data. And it's already set on mine to clear cookies and clear cached images. My browsing history is grayed out. Apparently the federal government wants to know what I'm browsing. But what you would do, you would click that as well if you had the option. Now that are hanging around that might have been muck-ups for the new version of Plan Finder. So there are a couple different ways to get around to comparing plans here. You can use this health and drug plans up here at the top and go find drug and health plans here. You can, sorry about that, scroll down and click Find Plans Now. So that's what we're going to do. So we then have, I don't want to share my email address, so I'm going to just close that out. I can pick plans for 2023 or for 2022. So I'm going to stick with 2023. I'm going to enter my zip code. When I was practicing this the other day, it was very cold and gray out, so I pretended that I was in Hawaii. And I want a Medicare Part D drug plan, so I click Apply, and then I click Start. Then it asks, do I get any help paying the cost of my drugs? So if I pick Medicaid, Supplemental Security Income, Medicare Savings Program, or Extra Help, when I pick Extra Help, I get two choices. I can pick full Extra Help or partial. If I pick full Extra Help, or one of these top three, I'm going to get the same cost sharing. So one of the questions we get is, how do I pick the right one? So that's, you pick this one or the top three, you're going to get the same cost sharing. And pick partial. It's then going to ask you, what level of partial do you get? 0, 25, 50, 75. And so you would know that based on the beneficiary's award letter. Is really the best place you can find that information. So you want to be sure and select the right amount to reflect the pricing that the beneficiary will have. So I'm going to pick Medicare Savings Program for this example. I'm going to click Next. Ask me, do I want to see my drugs? Yep, I sure do, because the drugs coverage and the costs differ from plan to plan. So I'm going to type in Simvastatin. And you can see as I start typing in it, it starts to guess what I'm looking for. That's it. I just hover over it, I click on it, and add drug. It's automatically going to populate with the most commonly prescribed dosage, quantity, and frequency. But in most drugs, you can change that if you need to. In this instance, we're going to pretend that this person takes a 20 milligram tablet, but I'm going to change the quantity because they just take it once a day. So they just get 30 pills every month, add it to my drug list. I'm going to add a couple of other drugs that are a little less common, just so you can see a few of the things that happen. So some eye drops, Timolol. If you have a liquid medication, you want to be sure and get the dosing information right. Sometimes when you pull down the dosing menu, there's like this has a gel solution. There's two options for this 0.5, and then there's even like tablet versions of this. So you want to be sure when you're talking to the beneficiary, you're getting all of this detail about, the eye drops or the solution, you also want to ask about like the size of the bottle. So on this one, we've got a 5 milliliter bottle, 15 and 10. So we're just going to leave it at 5, one of those a month, add to my drug list. Let's add one more drug. So this person has an inhaler called Ventolin. So I click on Ventolin, add the drug, and it says, hey, there's a generic version available. Do you want to use the generic? And so the beneficiary's like, oh, yeah, actually, use the generic. I just
Okay,
know the
enough
name.
fooling around.
So
Let's
we're going to
get
click
back
add
to
generic. If we didn't want to, we'd do the brands, but add generic. So when I do the dosage here, you'll see there's a bunch of different versions of albuterol. So we've got these first 3 that look almost exactly the same, right? Then we've got these nebulizing solutions. So if the beneficiary is using one of these solutions, that is a really good indicator that they're probably using this albuterol with a nebulizer, which is a piece of durable medical equipment. And that means that this medicine would then be covered by Medicare Part B, as in boy, instead of Medicare Part D. So if that's true, then you could educate them on that. And then there's tablets and syrups. But I don't know which one of these first 3 to pick, so I'm gonna pick the first one. And you can see the package, it automatically goes to 18 grams. Then I pick the second one and it changes to 8.5 grams. So it's really important to know which of these you need. And this last one is 6.7. I want the one in the middle, I want 8.5. It says you can buy in a pack of 144, but we just want one. So I add to my drug list. So just some important things. These are uncommon things, but may come up. So just helpful things to know. So done adding drugs. Then we get to pick our pharmacies. So this Penny was like, I've heard about mail order. It might be the cheapest. Maybe I'll do it. But really, I like to go to Long's Drugs. So we're going to pick that pharmacy. And we're also going to pick a Walmart pharmacy. You can pick up to 5 pharmacies. We're going to pick these 3. Then I just click done down here.
Yeah, good point.
Okay, so now I'm at the plan summary page. So I can see my
Good point.
location. I could change to Medicare Advantage if I wanted
Good point.
to. I could filter by insurance
Where do I want to go with
carrier,
what?
star ratings. But really what
Good
I want
point.
to do is just sort by this lowest drug and premium cost. That's going to be like my full year's cost, estimated cost, right? So I just picked the first 3. So WellCare, we're going to pick Cigna, and we're going to pick AARP. So we pick them, they appear down here, we click compare. So then we want to see, because I've got a couple of different pharmacies listed, and remember this person has extra health,
Friday,
so they don't
November
have a monthly
18th,
premium
8
or a
to
deductible, so we don't have to look through
AM.
that information. The next thing I want to look at
What's
is
the White
what's
Rose?
covered. So cool, this says 3 of 3
What's the
drugs
White
covered.
Rose Leadership
3 of 3
Institute?
drugs
I have
covered,
no
3 of 3
idea.
drugs covered. Super. If that weren't the case, we'd want to pick some different plans. Now what we want to look at is what are they going to pay? This is the total drug and
White
premium
Rose
cost of each
Leadership
pharmacy. So it looks like
Institute.
the lowest cost, you might have noted it already, is mail order pharmacy, either with WellCare or Cigna. But, this Penny is a little on the fence about mail order, and they're like, well, I'd really rather just go to Long's. The pharmacist goes to my church. I'm comfortable with them. I'd rather just do that. Okay. So the lowest price plan for Long's drugs is this one, the WellCare Classic plan. It's got a preferred
144
it's
Roosevelt
a preferred
Avenue.
pharmacy. Usually the preferred in-network pharmacies have a lower cost than just the in-network pharmacy, which we can see here with Walmart compared to Long's. Cool.
Did they change their name?
It looks like WellCare's going to be the best bet for this beneficiary. One last thing we want to do is we want to log in and we want to look at this plan details page. So of course, if you were helping this beneficiary and reporting Part D enrollment outcomes, you would come to this page. You would print a copy of this and either save it on your for uploading later, or print a hard copy,
Anybody I know?
Print it to PDF. But the last thing we want to do in here is we want to check and see if there are any utilization management requirements.
No.
And the way to do that is you got to scroll to the very bottom. So we're going to go past drug coverage. This is a lot of information we can see on the main screen. Here's our estimated annual drug costs again. Oh, this part's new. This is showing us how much the beneficiary would pay at each pharmacy out of pocket just for the medicine. So again, this is an estimate, but if they're going to Long's Drugs, they would expect to pay a little over $4. But again, we want to scroll down and get to this View More Drug Coverage section. When you open this up, you're going to scroll past this drug cost by tier. It's general
I'm not
information.
going to it. I'm not.
And
You're
you
not
want to
going
get to
to
this place called Other Drug Information. And here what you want to look for first is the tiering information. Make sure that there's a tier listed here. You also want to look at whether there are prior authorization requirements. So these three things are called as a group utilization management tools. So prior authorization is where the plan could require your provider to submit some additional documentation explaining why you need to take this medication before the plan will agree to pay for it. So these little dashes indicate that that does not apply on this plan to any of these medicines. So that's great. So you want to look at quantity limits. Now, if there's a yes here, you just want to click on the yes and see what it is. So for albuterol, it's saying there's a limit of 17 of these for each 30 days. And so this Benny only needs one. Perfect. That's within the limit. For simvastatin, we click the yes. We can get 30 pills in 30 days. That's exactly what the Benny needs. No problem. And there are no step therapy limits. So step therapy would be where the plan could require the beneficiary to take some other medication for up to 90 days before they would consider paying for the medicine that's prescribed. So those are just really important things to check for Bennies. None of them apply here, so that's great. All right, so that is an example of how to run an anonymous search. Now we're going to go do a logged in search, an example of an insulin user. So I'm going to go this time, I'm going to scroll down and I'm going to click log in. So last time
Come
I went
on, you're
here,
going too long.
it actually takes you to the same place. Well, no, it doesn't. This one takes you to the login screen. So I am going to be using a test account that CMS let me borrow. We do not have these for all ships use. We know how important it would be. CMS knows how important it would be as well. They've just allowed me to use it
Native
for
counselors
this
for
training.
opening.
So I've got my stuff copy and pasted in here. You can see the forgot username, forgot password links. Here's the one for forgot username and password. And then, you know, what if I've really lost things and I can't find my account at all? So those are your options, or calling 1-800-Medicare. So you click login. And we are looking at the account for John. So John, when we get to this main screen, we can do a variety of things. We can help John by printing a copy of his Medicare card. We can view any messages if he wants to look at them, update his drug list, lots of things. What we're going to do is go up to the health and drug plans. We're going to find health and drug plans. And it goes through and finds his information. So again, I mentioned this is a test account, so you won't see this one. So just try to ignore this part that I've highlighted here. So we have John's plan in 2022 is Elixir. If he doesn't do anything in 2023, he's going to continue in that Elixir RX Secure plan. Scrolling on down, you can see whether he has extra help. It would be reflected here if he does, but it says none for 2022 and none for 2023. You can also see the pharmacies that John has selected or likes to use. You can also see John's drug list. Actually add back his, he uses Humalog. So you would see this in his drug list. I was practicing earlier and took it out. So, sorry about that. So you would see this in his list. And one of the things you would want to do, because this isn't insulin, he's an insulin user, for our comparison this year, the first thing you want to do is remove that drug. So just like you just watched me add it, now we just want to go and take it off again. So the way to do that is click on Edit Drug List, click Remove Drug. It gives me a message, hey, you removed that from your list, and then you just say, okay. then we're ready. We're ready to go look at plans. We click Find Plans Now. It's just asking me to confirm my coverage. Ooh, look at that. It's still got the Hawaii zip code in it. So this is one of the things about clearing the cache every time that's important, because that is not John's zip code. So I need to make sure and type in John's zip code. I want to look at Part D plans, apply, and then I click Hamilton, Indiana. Start. All right, so what I have now, I'm also going to take these 3 plans off because that was our last comparison. So what I have now is a list of drug plans that are available to John in 2023. So up first will always be what he's going to be in next year if he does nothing. Then if you scroll down a little bit more, you can see there are actually 24 drug plans available in his area. So the best way I found to do this is to go ahead and just print a copy of this, because we want this list of what the drugs are going to cost without insulin so we can compare it later. And one of the tips I learned last week is that my PDF printer comes up and this will be the default. And see, it's a bit larger and it's 9 total pages. If you change the scale here under more settings to 70 or 75, it'll just fit better on the pages. So I'm going to do that. I'm going to click Save. Well, let me show you first up here. I've got the destination for the printer as PDF. Like if I had a local printer, I could physically print it. But I'm just, since we're doing this virtually, I'm going to save it as a PDF. And I'm going to save it in this file, and I'm just going to call it something that I'll remember. I'm going to say no insulin John. So I'm going to want to look at this again in a few minutes. Because now what I need to do is go back and add insulin. So one of the ways to do that from this is to just pick, we're going to pick the plan that he's in now. We're going to pick the plan details page. So this is going back and showing me, you know, more information in detail about his plan, his premium, the deductible, what drug coverage is available. Now, John doesn't have extra help like that first person we looked at. So one of the things that you might do when you're helping folks is click here. And as you get used to talking about this, you won't have to click here every time. But there's 5 different things listed here that people could do to help lower their costs. So one is switching to a generic drug. They could look for a Medicare drug plan that offers additional coverage during the coverage gap, so that pricing will be reflected on Medicare Plan Finder. There's nothing special you have to do to look for that. You could look for a pharmaceutical assistance program. So some drug manufacturers help people pay the cost of their medicine. Those can be really helpful. And then state pharmaceutical assistance programs.
Is this from?
Not every state has one of these, but if you do, they can be really helpful. And then applying for extra help. So those are some good links. Again, it's going to be on each page under drug coverage. Then you see the pharmacies, and you could actually add pharmacies here if you wanted to. You see the yearly drug cost by pharmacy. So that's just the medicine. Usually when we're comparing these, we really want to look at the drug and premium costs. So these are kind of high. So I want to scroll on down and look at this view more drug coverage piece, because I'm suspicious that maybe this plan isn't covering all of his meds, and it's not. So the omeprazole is not covered next year. So this, it's not going to be a good plan for him. It's going to cost too much. And one of the other things I wanted to show you is if there is a medication on the plan, it is going to make that's not covered on the formulary. The Plan Finder will estimate a cost. You see there's this cost estimated here, the retail cost $266.79, and then it applies that cost every month. This is just an estimate, despite the fact that it's got this little one that says this plan does not cover this drug. So that part we know to be true. This piece, this price is shown as the full cash price. That isn't always accurate, and that's caused folks some frustrations. So be sure, and if you have a beneficiary that's got a medicine that's not on formulary and you can't find a plan that covers it, they really need to contact their pharmacy to get an accurate pricing for it. So this is not going to be a good plan for John next year. So we want to help him find another one. At this point, what we want to do is add back his insulin. And so you can do that down here under other drug information. There's my drug list, and then you can change drugs. So we'll click here, we'll add one more drug, and we're going to add his Humalog back. Add drug. In this instance, John really needs the brands. It works better for him than the generic we're pretending, so we just click this, he uses it, he gets 5 pens, we'll add it to the drug list. We say done adding drugs. Okay, now we need to get back to the plan summary page that shows us all the plans, because we know the site gave us right back to the Elixir plan, and we know this is not a good one for John. So we're going to go back to search results. We're going to hide Elixir. We're going to take it off the list of plans we want to look at. I'm going to go ahead and pick this first plan because I know that it's, in some research I did, I know that it's a Part D senior savings plan. So I'm going to add that one to compare. The next thing I'm going to do is I'm going to bring up my list that I saved, my No Insulin John list. And I want to find the least expensive plan. So the first one is Cigna Saver RX. So we need to scroll over here and scroll down and find Cigna Saver RX. Okay, got that one. And then let me get the next one. The next one is Humana Walmart Value RX. All right, so Humana Walmart Value RX. Humana Walmart Value RX. Where is it? Not on that page. Let's go to page 2. Humana Walmart Value RX. There it is. All right, add plan. And then we compare. All right. So really what we want to look for here is first, are all of the drugs covered? 3 out of 3 on Cigna RX, Extra RX, 3 out of 3 on Cigna Saver RX. Ooh, Humana Walmart. Nope, 2 out of 3. All right, Humana Walmart, you're out of there. Because the only drug that we added was the insulin, and if it doesn't cover the insulin, it's not going to be a cost-effective. It's not going to be a plan that John's going to be able to afford. So what I've done through the magic of preparing for today is under the Cigna RX plan, I'm going to make a comparison. Now look at this out-of-network pharmacy cost. Okay, so there's no way you'd ever go to Suburban or orthopedics to fill this because it's just too much. You would go to Walgreens or you do mail order. Or you could add another pharmacy, I suppose, and see. So what I'm going to do in my magic spreadsheet over here is show you Cigna RX, this $1,012.60. We've got Cigna RX. It's a Part D senior savings plan. The cost with insulin is $1,012.60. And then we're going to compare it with the Cigna Saver RX. So this is showing $35 a month times 12 months equals $420. So that's what the insulin would cost him for the whole year. This amount, the $349.32, where did I get that from? So that came from my No Insulin John list. So I pull that back up, and you'll see here, Cigna Saver RX, the retail pharmacy cost, $349.32. Okay, $349.32. Yep. Then I add those two together, and I get $769.32. So when I subtract the difference of these two, I get that John would actually save $240 and some change by picking the Cigna Saver RX plan. It has the best cost and coverage for his insulin. So what you'd want to do is go into the Cigna Saver RX plan. If you're doing Part D enrollment outcomes, you print this page because it has the insulin included. You save it, upload it later. And then for John, because you want to send him home with something that has the costs associated with his plan that he would expect. So you want to go to, where is it? Oh, here we go. View more drug costs. Change drugs. Take this Humulin off. Done adding drugs. And then go back. And now we're back and print this cost.
Are they supposed to be seeing a spreadsheet that you're adding that to?
Oh no, yes, I had moved it over. That didn't work. Okay. So you cannot see a spreadsheet now, I'm guessing.
That's correct. We can just see your Medicare.gov the whole time.
Yeah, everyone. Oh, that's a real bummer. Okay. Let's see. Nope. That's not it.
Well,
Well,
I can see a spreadsheet now with the insulin comparison sheet. Is that what you're trying to show?
yes. Yeah, thank you.
Yep.
Okay, thanks, Sue. Sorry about that, everyone. That was probably really confusing. So what I was trying to talk through is the Cigna Extra RX plan. I added that $1,012.60 here. And then I figured the cost for the Cigna RX Saver plan. And so you can see here's the difference in the cost of the two plans. And why this non-senior savings plan actually ends up being the better coverage and cost for John, which is, potentially not what you would expect. So I just wanted to show that. So then what I was attempting to do is show that what you would want to do for John, so that he'd have something, if you send things home with people, is print a copy of this version that does not have the insulin. It shows his costs here as this kind of tiny, but $349.32. Somewhere on this page, you would want to add the $420 for insulin, for $35 copay for every month for 12 months, so that he knows he's going to have that added insulin copay cost on top of this.
It's just endless.
So that is the
PowerPoint presentations.
process that we are going to need to use for Medicare Plan Finder this open enrollment period. And I think we ought to stop there. Probably go to the resource slide that Jenny wants to show and then come back and do questions. And I'm sorry, we're not going to have time to do the Medicare Advantage comparison plan finder today. So let me stop sharing and see if I can't pass the ball back.
I'll just steal it from you. How's that sound? Is that easier?
That's perfect.
All right, and I'm going to jump ahead to Jenny's slides, and Jenny, here's the ball for you.
All right, thank you, Sue. So what you see here is an image of someone who is logged into our website, and they have gone to Resource Library in the navigation pane, and they have typed in OEP as a keyword search. That's just a visual tip for you to easily find resources in the library that are related to the open enrollment period. This is a compilation of what we consider key OEP resources, and there are 2 slides on this subject. In this slide, you see that there's a package of CMS Unique ID user resources. There were several questions about this in the chat, we noticed, and this resource, which when you download the slides, if you're able to download the slides, this is hyperlinked, and it will take you to that package of resources. Next, there was a webinar on plan marketing guidelines called Can They Do That? And it has the recording, the PowerPoint, and several important handouts. Then you have a compilation of 2022 Medicare Plan Finder resources that we've been creating based on ACL and CMS announcements, and it contains many of the documents that Melissa has talked about today. Then there is a guide on creating and using Medicare.gov accounts that was developed by ACL. And then again, training on using the complaint tracking module, or CTM, and guides on the SHIP casework process when there are marketing complaints. And these packages interlink, and they're also going to interlink, especially the Plan Finder resources will interlink with the webinar resource for this week's webinar series. Then on the subject of Part D enrollment outcomes, I know there was a lot of chat and a lot of material presented on this. We have these 3 major resources. I want you to especially notice the new ACL tip sheet. And again, anything that's blue and underlined is a link. So if you're using the PowerPoint, it will link to these resources. You will have to be logged in, and I'm going to talk a little bit about logging in again in a minute. So there's this new ACL tip sheet. It sorts out some of the confusion some of you might have regarding plan comparisons and insulin. It's very well laid out. It's short, so if you are tracking Part D enrollment outcomes, please do review that. Then the STARS manual, Chapter 7, is all things related to Part D enrollment outcomes, and it does include tips on how to print those plan details, and it's updated with the new guidance about the plan details for your verification documents. And then Melissa mentioned the videos that we have that were created by Sarah Fleming on our team. There are 4 micro training videos that demonstrate the PDEO data entry process and also getting the verification documents and plan details. What isn't mentioned here is training webinars, but if you use our library, they are interlinked with these resources as well. You will need to have access to our library to access materials. Our resources are password protected. This keeps them from getting into the wrong hands. So here is the process for logging in and getting them. You use the login button at shiphelp.org. And if you don't have an account, you're going to need to request one. When you click on that SHIP login page, there is a green button to register for an account, and then that account needs to be approved by someone at your program. We don't approve users at the national level. We leave that to administrators and directors at the SHIP programs. But if you do have an account, then go to the resource library and you can just view the recent resources. A lot of these resources are going to be right there at the top. Or if you're waiting a week or two and other resources have since been added or updated, just do that keyword search OEP
Can you
that I
get
showed
any
you.
more?